you are so many things in one. Help me understand, if I could ask you just to summarize who you are and how you introduce yourself.
Well, thank you, Josephine, for having me on this pod. My name is Crispus Mwemaho, just like you mentioned, and I am a medical clinician by profession and someone who got interested in climate action. So when I was starting this, I had this, like 5-6 years ago, I had this interest in linking climate change and health, which was obviously my profession.
So health came first?
Yeah. I was a clinical student at college, and I got interested in climate change because I felt like my niche was outside the hospital setting, and I felt like I needed to be in communities. So I was lucky enough that actually I did clinical medicine and community health. So for me, community health stood out for me than medicine. I don't want to say that medicine is not good, but my niche felt more in the community.
You're working with the assumption that I understand the difference between clinical health and medicine.
So basically, medicine looks at diagnosis, treatment, and of patients, but community health is a bigger component of looking at people who are sick and those who are not sick. So whereas medicine sometimes just looks at people who just come in the hospital, they are maybe suffering from illnesses, you diagnose them, run tests, and then give treatment based on what they are suffering from. But community health looks at prevention, looks at...
the health of the community.
Yeah, the health of the community. And so for me, when I was looking at the health of the community, what stood out for me at that time was climate change. It was affecting a lot of aspects.
What have you seen in the community? Share a story with me that you've seen or encountered in the community that brings me along your journey.
So I think there are like two. One, I come from Zimbabwe. That's where my village is, and we are predominantly livestock farmers. And this area is known to be very dry. And I remember growing up, every dry season, our livestock would die, and sometimes we would move to other places to look for pasture and water for our animals. But at that time, it didn't resonate, really. And then building on what I told you, coming to school, going to a clinical school, and then staying into this area. So I started collecting information when I was doing this work, when I started doing activism, because I didn't want to be just like any climate advocate that was, growing at that time, where I saw most of the activists in Uganda would just, I'm sorry to say this, would just copy and paste what was the climate activism in the Western countries to bring it to Uganda, and it didn't make sense for me. You're holding, for instance, 1.5 degrees Celsius on streets of, let's say, Kampala, or even...
So you're holding a placard.
That just says... But it doesn't make sense to a border person. But if you tell them, if you mobilize them to do, let's say, cleanup, it resonates with them because this is a problem that is close to them.
If they understand why or what this means.
So for me, it was blending action and message. And that's how I actually learned eventually that actually the climate change itself has an impact on the things that we are seeing in the ground, on the ground. And also the actions, the everyday actions, behavior, form a bigger impact on either the impacts that we face, and if we face them, the magnitude of how we face them. So to me, it was, this lived experience as growing up as a child. At that time, I didn't know until I stepped into the field, and now I started, knowing, this is actually why
animals were dying.
This is actually why we are seeing these floods. And along the way, actually now, I started to, specialize, because climate change is broad, and this is where people don't get it. You cannot be an advocate of whole climate change. You have to, I'm not saying it is wrong, but it is almost impossible for you to advocate for everything on climate change.
What are you advocating for?
So right now, as I grow into the space, I blended into what I grew up seeing, what I experienced in the ghetto, and why my passion and profession is. So I do advocacy on things to do with migration, environment, and climate change. So the nexus itself, I also break it down, and I look at displacement. First, displacement. I co-founded an organization along the journey, Abayuuti Climate Action Network, and we work with climate-displaced communities and other at-risk communities. So, for instance, in the ghetto, you might not be displaced today, but every time it rains, you're at risk of that temporarily, floods and all that. So that's what we are doing as an organization. And it feels home, because now I feel like the problems or the things that I advocate for, I've lived through them. I know much about them. And I even have the experience as a professional and someone who is working directly on ground.
What did you say we should call you?
A practivist.
A practivist. All right. I understand that you trained in community health and community medicine. And I also understand that you worked with the Ministry of Health and other specialists in drafting Uganda's country position paper on health and climate change for the 2024 International Climate Change meeting. Tell me about that.
So, as I said, the health and climate nexus in Uganda is not well understood, not only to the general public, but even to the medical professionals or health professionals themselves. And we have not done that only last year. In 2023, I, together with my other colleagues who are health professionals, led by a doctor friend of mine from Tree Adoption Uganda, Dr. Charles Bate, we started an initiative to gather inputs of health stakeholders who are doing climate change work as a precursor event going to COP28 at that time, to ensure that the insights, the demands and needs of people working in the health and climate change sector are also included in the Uganda position paper going to these conferences of parties.
What did you find?
And
key highlights.
Yeah. So the key highlight is that at first people were not involved, health stakeholders were not involved in the conference of parties processes here in the country. And that's what we wanted to actually stop. You're going representing the country, but the health sector as one of the most affected sectors, and also one of the most important sectors in the country, is not being included in the position papers. So we wanted to make sure that these people we have voices in there, and we started doing position papers. So last year it marked our second pre-COP event, and every pre-COP event, so we have the Health and Climate Change pre-COP symposium, and this symposium we usually have very many stakeholders, ministries, departments, and agencies of government, civil societies, international organizations, UN agencies like WHO, and so we come together and agree as Ugandans who are working in the health and climate change sector, what do we need to be included in the Uganda position paper going to these COPs? And we usually point out different demands according to the conference of party agenda, and also the different themes, whether it is adaptation, what do we want in adaptation? What do we want in mitigation? What do we want in loss and damage? What do we want in technology and technology transfer, agenda and all that? So we want to, decentralize these things, not just having just one line as climate and health, but also to have theme per theme, things that we want as a country and be represented at the highest, stage of climate and health negotiations and discussions.
Have you attended any COP?
Yeah.
Conference of Parties?
Yeah. So I have attended the Conference of Party from COP27 in Egypt. I've actually attended 3 consecutive of them.
What's the feeling there when you are a Ugandan practivist and you're listening to all these conversations? What are you thinking? What are you feeling? Does this resonate? Do you relate with any of this?
I actually had a chance to go to COP26 in Glasgow, but I felt at that time I didn't want to go there because I was inexperienced in terms of understanding the policy landscape here in Uganda, what are our demands when we are going to different COPs. I was not so much engaged in different activities here in the country in terms of COP processes. And then at that time, I also didn't feel like if they put a mic in front of me, speaking on behalf of Uganda, what am I going to demand? So I made effort to make sure that I engage on the local and also understand the international, the UN, the United Nations Framework Convention on Climate Change Processes. Mm-hmm. And then in COP27 in Egypt, I went there very passionate. And to be honest, when I reached there, as someone who at that time had invested knowledge, been working on in communities that are affected by floods in Kasese, desperate for action. So when I reached there, the first slap in my face was like, you cannot enter negotiations unless you are part of the Ugandan delegation, which are doing the negotiations. So I was like, oh, I can do this. But then I also started attending different high-level events where I was given an opportunity to speak. And all of a sudden, I felt very, the discussions there are very much political. And all of the time now, the third one, I feel like I'm losing interest in attending conferences of parties because it's usually just talk. Last year we had these talks. This year we were going to do this again. And it's more like they don't resonate with what I see in Uganda, what I see in the communities that are, for instance, the camps that we work with, people are in survival modes. And you're talking about things, by 2030, by 2050, people need immediate action. And we don't have to go into these different negotiations taking forever, So I honestly was much disappointed as someone who really was passionate about action. But yeah.
Crispus, you went ahead after you were refused entry into the room because you weren't a negotiator. You went ahead to be a negotiator under the United Nations Framework Convention on Climate Change, particularly on climate adaptation, from what I read.
Yeah.
What is that like when you're a negotiator? And what were you negotiating? What were you saying?
So to be honest, right now, I haven't taken a center stage, for instance, to negotiate on behalf of my country, but I'm always with the team of the negotiation team of the country on adaptation. So, but how is it like? So there are different positions. When I'm talking about positions, so it's like, for instance, when we are negotiating about adaptation, and adaptation itself is broken down further into things like, for instance, last year, we were negotiating on global goal on adaptation, which looks at how do we ensure that communities adapt, develop coping mechanisms. And this is also further broken down into who is going to pay, who will receive money, and then if they will receive, what is the quality of the money that they will receive? Is it grants? Is it loans? But then for us to even reach an agreement for you to reach an agreement of you're going to receive the money, for instance, it takes years and years of time. I'll give you an example. There's been a negotiation on loss and damage fund in United Nations Framework Convention on climate change for as long, I think, since 1992, if I'm not mistaken. But the breakthrough agreement came in COP27 in Egypt. So you can count how many years have passed. So people have been negotiating, especially from low developed countries, which are most affected, of course, that we need loss and damage fund for us, for our people who are actually, for instance, displaced and they lose everything because of climate change. So we need to compensate them with loss and damage funds such that they can, adjust and build resilience in different ways. But it took almost 28 years for the breakthrough to come. And even when it came, the money has not been released. Now they are discussing who is going to host the money, how is the money going to be channeled. So that is what I'm telling you, that negotiations are not just something that you go and you expect that you come off the rooms when everything is okay. It takes many years. And to me, that's why I was disappointed, because the impacts in themselves of climate change are immediate and they're affecting people daily. But then the actions that are needed and we are negotiating for take forever. So there is a discrepancy in the way that we act in these big decision-making tables and what is on ground, what people are facing. Yeah.
Are you actively negotiating away from the big decision crowds, but just here in Uganda, in your community, with the local leaders around health and climate? What is your negotiation like?
So here right now, what we are trying to do in the country, for instance, last year the Minister of Health launched Health National Adaptation Plan, which is a 5-year plan and demonstrates what the plans that the Minister of Health and the government of Uganda have in order to build resilient health systems in Uganda. But it is not only Uganda that, only having this plan will ensure that the health systems themselves are resilient. But what comes out from these negotiations, because at the end of it all, the plan needs to be financed, and you realize that the finances that come from our government is just a drop in an ocean. The plan has to be facilitated by either grants from developed countries and also from different UNFC funding mechanisms like the Adaptation Fund and all that. So it's not only having the plan that will make Uganda independent. We need implementing, finances, capacity building, and all these require finances. That's why for us, negotiations at the high level are important, because they give us means of implementation. And maybe other things that we are now trying to advocate is we have been seeing the reluctance of, big countries, polluting countries that we demand to get finances from. So as people, practitioners in Uganda, we are trying to convince the government, hey, what if these people actually do not give money to us? What shall happen? So we need to do local mobilization of funds, and we be able to implement our plans. Otherwise, they will just be on shelves for the next 5 years. And then in the next 5 years, we also do another revision and still do that. So for me, I've actually been trying to advocate for local financing from the government, such that the plans that we have, the development that we do, is resilient to climate change impacts. Otherwise, we cannot rely on external funding. It has not worked.
If money was not a problem and you had all this money at your disposal, what would be your first area to prioritize?
So if money wasn't...
In health.
in health.
And thinking about the community work you're doing.
Yeah. So one thing that we should take notice is from the vulnerability impact assessment, it showed that most of our health infrastructure, our health workforce, is non-capacitated to, respond to climate change impacts. So one, we need the infrastructure that is resilient to climate change impacts.
What does that mean?
It means that you're building an infrastructure that is proofed, or with a very good structure in terms of strength and also planning to be able to cope up with the, let's say, floods, landslides, hailstorms, and all these other climate change impacts. You will see, for instance, I'll give you an example of a health facility in Kasese where we work from. It is called Kirembe Hospital. It was demolished by floods back in 2020, and this hospital was serving over 100,000 people in that district. So you can imagine where are these people getting, health services from. Yes, there have been efforts to upgrade some health centers and also downgrade the health services that were being received at that facility to other health facilities. But still, the people within that area are suffering, So for me, we need climate-proofed, infrastructure. We need to build the capacity of our health workforce to ensure that when, for instance, a patient comes today to a doctor, they don't just prescribe to a patient just medicine. In the health education they are giving to this patient, they need to incorporate climate education such that, because patients take what they receive from their health service providers as a very good information.
We're seeing doctors as influencers now.
So imagine you went to a doctor and, for instance, if you had, let's say, malnutrition, your kid is having malnutrition, you're now being told to, how do you incorporate, nutritious foods in your planting, and also how you can plant fruit trees in your garden such that your kids can get, these fruits. So this is climate action that is being relayed from a doctor, medical personnel to a patient, and they will take that. So we want the health workforce to also to build capacity of the health workforce to respond not only to the impacts, because as I mentioned, there are areas which are, hit so hard, and the aftermath are, for instance, mental health, and some doctors do not have a correlation between mental health and climate change. So how well will you treat these patients if you don't know the intersection between climate change and mental health, for instance?
That's if I believe in climate change.
So some doctors...
And if I believe in mental health issues.
Yeah. So even in our training as health service providers, we're not taught about climate change. This is something that I taught myself. So we want climate education to be integrated in medical, clinical training, such that the people that we have, the graduates that we have, one, know that climate change is real. Two, know what to do when the patient is presented to them with, the underlying factors of all their illnesses being climate change. How do you make sure that you inform this patient to also go back and take action in terms of mitigation and adaptation of climate change?
You said something, and I know that I'll get questions around it, of their illnesses being climate change related. To correct that, climate change related. I have so many questions for you, but you were just going on, and I just kept thinking, what does this guy, and I should have started calling you Dr. Crispus from the moment you walked in, but I stuck with Crispus. I apologize. What does your typical day look like?
So right now, I work with my organization full time,
That's Abayuuti.
Yes, Abayuuti. And we work with a range of communities. We work in Kasese. We work with a camp called Muhocha Internally Displaced People's Camp. It is hosting exclusively people who are displaced by floods, permanently displaced. You've heard of a story of River Nyamwamba, and every time it rains, a lot of people are displaced from their communities. Now, there's this camp which is hosting over 1,500 people, and they are, in real sense, refugees in their own country. And what we do is we have various projects that we are implementing there, one being climate smart farming to ensure food security, because these people now rely on external aid in terms of, food relief from the OPM, Office of Prime Minister, other humanitarian aid. But we know that with the reducing and redoubling humanitarian aid across the globe, the impacts in the camps is alarming. When you go there, you smell food insecurity. People there skip meals and all that. So we are trying to support families to produce their own food. And what we do, we rent land in camp host communities where now we give an opportunity for them to continue farming. But we don't just stop at that. We train them with practices that can withstand climate shocks. And I was impressed when you mentioned about your project. I was like, how best can we work together? Because ideally, this is the same thing, but we are in a different region. I don't know how possible it is. But it is an interesting project because we are working with people who have been displaced by climate change. And I can say that, loudly and clear. So these are people who are displaced by climate change, and we're working with them to ensure food security through climate smart farming. And we also do skills development for green livelihoods and sustainable livelihoods. These skills range from things like crafting. We have trained people in soap making using locally available resources, tailoring for women and girls, and other things. But we also do have an education program for displaced children. We have a pre-primary school in the camp, and we are offering free education to these kids.
This is all you?
All my organization.
Well, you and your team. Okay, your organization.
Yeah.
How long have you been in existence, this organization?
Yeah, we were established in 2020 as a group that was working in the ghetto in camp along Sao Paulo, Kagwa Road.
So you went back to your university area and said, let's start from here.
So that's where we started from. At that time, we were just doing community cleaning. But at the time where floods were hitting the country left, right, and center, we interested ourselves in working with people who have been displaced by floods, given that we were from a community that experienced floods. So we knew the impacts, So I remember in 2020, we went to Kasese and we are carrying humanitarian aid. We had done some fundraiser, gotten some food stuff, flour, beans, clothes. I mobilized university kids, gave me clothes and all that to take to the people who have been displaced. And when we reached there, I was so shocked. We were carrying a truck of food. So in my heart, I was like, at least people will be going for a week on this food because it was huge. And when we reached there, because people were many, they were only taking 2 cups of flour, each family. And I was like,
this is not a week.
It's not
a day.
It's not even enough for them to carry for 2 days. So we started thinking, how best can we do sustainable projects that are not just relief, because relief can never be enough for people, in these situations. And I also think that we need to redefine the kind of humanitarian aid that we do in modern era.
It has to be sustainable.
It has to be sustainable.
It has to outlive you.
Yeah. So we started now we did a community needs analysis, and people told us, we have been farmers all our lives. All we need is, if we can get a chance to get land, we can then start, restart our lives. And we started mobilizing funds and supporting some families to rent land in camp-host communities, and they are able to till and produce food for themselves. Surplus is sold for them to continue renting the land, so which is more a bit sustainable for them, not only in terms of food, but also they are able to integrate intercrop cash crops and food crops. So they are at the end of the season, they are able to do some household needs and also get food. Yeah.
4 years now running?
4 years.
Give me some hope, Dr. Crispus. Tell me about a family that you've seen that this has been impactful for them.
You mean a project, right?
From your project, a family that you've engaged with, and you can see that this is working.
I think all our projects have been tested and proved. To be honest, I'll give you a case study in all of the three components I mentioned. Not to say that they are the only things that we are doing, but for instance, when we started a pre-primary school in the camp, our idea was that at least someone can know how to read and write their names, And when we started, at least now we get sponsors who come to the camp and see kids getting education, and they are like, "Oh, so now after this, what are you doing?" So they are able now to give them scholarships. Last year, we got we promoted 50 kids from our pre-primary school, and all of them were given a bursary in a neighboring school in Kasese district. But not only those, we have been getting a lot of bursaries just because of this initiative. But if it wasn't there, people wouldn't notice that displaced children are not having school. The second component is the farming. When we are doing the grouping of the people, we take an acre, 2 to 3 people, 3 families actually. And the people that we started with in 2023, for instance, right now, they are independent. They're not doing as a group. Each one of them can have managed to go and rent their own piece of land bigger than what we started with. And for us, it's a plus because now these people cannot just wait to have food from government, but also they can be able to have life as they used to.
This is a long way from a truck full of things with 2 cups of flour to now people having their own pieces of, larger pieces of land they can grow food on.
And just of recent, you mentioned the Mercedes-Benz Fellowship, where I am a fellow. They got me because of the work that we're doing. When I applied, I pitched the project that we're doing, and I think tomorrow I'll be going to implement a project that they are funding. They're funding the expansion of this work that we are doing. So we've been working with 20 households, and now we received a project that will help us scale the number to about 70 households in the camp. So I
didn't properly. I spoke about the Mercedes-Benz Fellowship before we started the podcast. So I want you to tell us very briefly about it. You are a Mercedes-Benz Visionaire Fellow, 2024, 2025.
Yeah.
What is that about?
So the Be Visionaires Fellowship is a fellowship that is supporting young people across the world in sustainability and climate action. And they are taking young people from the age of, I think, 18 to 28, and they develop them in terms of capacity building and mentorship on their projects, and also fund them. So when you finish off the year, you're given a chance to pitch your project if it is, eligible for funding, and it has grown to that capacity.
Okay.
But wide enough, for me, I was starting, I'd been working on my projects. So it was easier for me to get into the fellowship and get, mentorships from venture coaches, mentors. And also when this opportunity for the grants came, they already had seen what I'm doing and, were interested in funding me. And that's how we started.
There's a lot about you. At what, 27?
28.
28 now. How
Yeah.
are you doing all of these things in such a short period of time? You were the winner of the Future Together Award in 2022 for your outstanding work in climate refugee camps in Western Uganda. Just tell me a little bit about that as well.
Yeah, so just like I mentioned, to me, Abayuuti, my organization, I take the work we're doing so dear because I think in as much as small we are, I've seen big corporations and big organizations which are not, I feel they're not doing as much impactful work on ground as we are doing.
And compared to their size?
Yeah, compared to their size. I in fact, one time hosted one of people that I won't mention here. And when they saw they were visiting us and I showed our different initiatives. And I remember this lady telling me, she pulled me on the side and told me, do you know, Crispus, how much money would big organization be accounting for this work that you're doing? I said, I don't know, but
you're not doing enough accounting.
so she was like, I feel like for big organizations, if they had this kind of work, they would be saying millions of money that I've injected. And she was wondering, how have I been able to do all this work when we don't have big funding? I said, one thing, it's the will to do what we are doing. And for us, we have interested ourselves in not just being, activists who are just talking. I think talking is so good, but it would also be very good if it is complemented with action. The most obvious one we have now, last year we collaborated with funding support from UN Migration and Global Green Grant Funds. We were able to do a short documentary that features climate displaced people. We wanted to paint, to give a platform to these people because for them, they cannot afford to go to COPs. Every time I would go to COP, I felt I wasn't the right person to talk on behalf of them. And I was wondering how best can we do this to take their voices into these, conferences or parties. So I had this idea of documenting their stories. And when I go there, I play it. So we had this support and we were able to do a documentary that is now live on our YouTube channel. So anyone that is interested, I'll share with you the link.
We'll put it in our show notes.
Yeah, so you can be able to see. It featured people sharing their experiences, how they were displaced, how life living in a camp when you had a home. And it sometimes doesn't sink well in the ears of privileged people who are the doorways to, let's say, climate financing and all that. But for someone who had a home, who had a farm, at any one point in life, they didn't even think they could be there just having to rely on aid for survival. But now a flood comes and you lose everything and you're in a camp. That has a very big psychological toll. Like,
when you talk about this, I'm reminded of when people say, climate change affects vulnerable communities, and then people don't care. Not knowing that vulnerability is not something you grow up with. You can become vulnerable
at any point
of, something that's happening. So very briefly, Future Together 2022 award.
Yeah, so this award was awarded to me by the humanitarian group of young people in Asia. And they were basically looking at young people who are championing climate action in their communities. So at that time I had, it was in 2022, I had already started working with the refugee camps. I call them climate refugee camps because when I go to the real refugee camps and I go to the IDP camps, I would rather be in a refugee camp. And if you ask any, displaced person living in these camps, they will tell you, why are we treated worse than the refugees? Refugees get monthly, sometimes at least. Okay, but even the services there, they're much better. I will tell you, I'll interest anyone listening to this pod to have a very grounded research on comparing life in an IDP camp,
internally displaced people,
and a refugee camp. You'd be shocked, to be honest. And I tried to ask myself, I asked most of the, big organizations that I usually interact with. And I'm like, why is it that it is easy for you to go in the refugee camp and work there, have projects there, but it's not for the IDP camps? And one of them told me this analogy that they use, that, for the IDP camp, the donors, humanitarian actors believe that these are nationals, so the government is taking care of them. But the refugees are just here for themselves. And I think that narrative has to change, because when you go to the IDPs, especially climate displaced people, for at least people who are maybe affected with conflict, which I don't believe that we have any other moment. I don't know if they are much popular at the moment as maybe in the early 2000s in northern Uganda and all that. But it is not the same attention as we saw going to, let's say, West Nile at that time when there was a lot of conflict. When it comes to climate, displacement, it is not given attention. And that's why we did this documentary. We wanted to shed light on, displacement in Uganda and beyond.
You've taken me into so many places that I want to go and explore, especially with the refugee settlements and the internally displaced camps. But we'll lose track of this particular episode. I don't even know how we're going to make it into as short as it should be. There's so much stuff you're telling me. Tell me a bit about the work that you do with Kampala Climate Cafe. What I read is that you're the founder and CEO, and it's a capacity building and networking platform for young people in Uganda that are interested in climate change, environment, and sustainability.
Yeah. So the journey to that cafe started in 2022 when I traveled to COP27. So I found many Ugandans in COP, many young people who are doing a lot of work. I am from Uganda. I don't know these people. So I was like, what can unite young people who are doing stuff in climate change to come and, network, learn from each other, but even collaborate? Because sometimes we are doing same work in silos. And I believe if we could come together, we would actually collaborate, partner, and make bolder,
Where
actions.
Do these young people who are not at COP but would be interested in the cafe find you?
Yeah, so when I came back, I was giving you like a background to the cafe. I came back, I was interested in having just a hangout where people come, and it's not really very much official. So it is, I would say it's Gen Z friendly and not...
That disqualifies me.
No. It's just chill. So we started hosting these cafes where we would bring activists, students who are interested, even old people who are interested in the work that we are doing. And it blew up before I knew. So for me, I already thought it would be just a hangout where we are like a small group of 10, 20, 50, I don't know. And in the first call, we had like 100 people. And I was like, I don't have this capacity to hold these people. So how best can we do this? So I started engaging other partners to host this, to come together. And it blew up. I'm telling you, it blew up. Actually, we had paused the cafes because we were restructuring and everything. But I'll tell you, every space I go on, I'm known because of the Climate Cafe, not the work that Abayuuti. And I feel, not good about it because, I've been around doing all this work. And for you, because you know me because of cafe, you think I'm just cafe. But I also get it. I get it because young people found purpose in this space. And the networks that young people made from this space, I get testimonies of them. I met this person on at the cafe, and we've been able to do this and this. And to me, it's inspiring. It's motivating to see that we still lack that big platform where young people can come and share their ideas. In one of our recent cafes, our last cafe actually that we had an exhibition, and we were very much, fascinated with what we saw. Young people doing a lot of innovations in environmental sustainability, climate action, and for me, I think maybe it is also an opportunity for me to pitch. We need a bigger space for the cafe.
But you're not answering my question on how listeners who are interested in what you're talking about would join this cafe, would participate. Where are you?
So the cafe, we have a social media handles. We have, they can also directly reach out to me at the moment via my social media handles to learn more about the cafe. But we also do have the Twitter and Twitter or X. And X. I'm not informed so much. X and Instagram, and also LinkedIn, where they can find us and know much more about the cafe. Yeah,
we'll put some of the details of that in the show notes.
Sure.
What would be your parting shot for us? I know we've gone all over the place. This conversation was supposed to be heavily tagged around health, but then you have just so much experience in little pockets.
So my parting shots would be in two ways. One, to someone out there who feels that they are overwhelmed, climate change is huge, you don't know where to start. Start with where your passion lies. Your passion will drive you to do even much bigger things. And two is, I want to highlight the need for us to be intentional in our development as a country, to ensure that whether it is works for the roads or agriculture programs, health programs, they are climate sensitive. Because right now, there's nothing that we can do and is not sensitive to climate change, because it is the reality of what we are facing at the moment. And for me, we cannot wait for the billions that we keep negotiating for. We need to start rethinking how best we can use our internal resources, our national budget, to ensure that we have meaningful climate action, especially in the communities where it is much needed.
Thank you very much, Dr. Crispus, the Proactivist. It's been a real pleasure having you and listening to all of the things that you're doing. And I'm hoping that we'll be able to host you again soon, and maybe get some of those contacts from the cafe to host more young people speaking about climate change and how it intersects with just about everything that concerns us. So thank you.
Thank you very much for having me as well.